I mean, one of our other programs is around domestic abuse. Now, domestic abuse is an unusual crime in that it's not something that's limited by deprivation. So domestic abuse cuts across all social, economic, racial, gender barriers and can affect anybody. So we know that 1 in 4 women, for example, in Scotland will be victims of domestic abuse at some point in their lives. And for men, there is a similar figure, but it's just not as much. So we try, we're very aware that we can't go and deal with all the victims of domestic abuse, although occasionally we will see them coming into our clinics or our surgeries. But what we do is we educate health professionals in how to recognise domestic abuse in their patients, how to reassure the victims, and how to signpost them on towards help. It's one of these things, you know, that's a situation that's best dealt with by people who have a lot of experience of it. So places like Women's Aid and other organisations like that are best to deal with the nitty-gritty of domestic abuse. But what health professionals can do is that they can signpost people towards these organisations and hopefully get them to get the help that they need. But the trouble with it is people put up with a lot, and it will on average take 35 instances of abuse before somebody will seek help, and probably 6 to 7 attempts at leaving the situation before people actually do leave. And there are loads and loads of different reasons for that. You know, many women won't leave because they don't have the financial capability to support themselves and their children if they do leave. Children are another big issue. And there's just loads of things around that. Another reason, though, interestingly, why people don't leave is because they don't know what's going to happen to their pets if they do leave. And that does prevent people from leaving, because shelters for domestically abused women will take them, obviously, and their children, but for lots of perfectly reasonable reasons they can't take animals. You know, they may have other people that are allergic to them, for example, and so they struggle to find somewhere to put the dogs, cats, rabbits, guinea pigs, whatever. Well, I think most of that's through our domestic abuse initiatives with healthcare workers. So we train dentists, we train vets in domestic abuse. And one of the things that we're just about to start doing, along with Police Scotland, in fact, is to train general medical practitioners in how to help victims of rape and sexual assault. So it's rape is a difficult crime for people to report. It's also a difficult crime for the police to prosecute because it's often just one person's word against another. And most rapes actually do not occur with a stranger jumping on you in a dark alley. That's very unusual. Most rapes are actually perpetrated by somebody who knows the victim. So that makes it sometimes even harder to prove. And sometimes it happens in a domestic abuse situation where the two people may in fact be married or cohabiting. So the reason that we're training the GPs is because if you want to gather forensic evidence for a rape crime, you only have 7 days in which to do that, from the time the crime happened until the evidence is effectively lost. So we're encouraging GPs, if their patients come in and tell them that something like this has happened, to try and get them to go somewhere where they can report the crime and have that evidence taken, and then it can be used at a later date in court, and they'll have much more chance of getting a successful prosecution then.